to make a very big announcement and a very exciting announcement to announce the selection of Dr. Karen Hacker as the new director of the Allegheny County Health Department. And let me just talk a little bit about Dr. Hacker. She currently serves as the Senior Medical Director for Public and Community Health for the Cambridge Health Alliance in Cambridge, Massachusetts, as the Chief Medical Officer for the Cambridge Public Health Department, and as Executive Director of the Institute for Community Health. Prior positions with Boston Public Health Commission, Boston Medical Center, and Dorchester Health Neighborhood Health Center. Reflects a strong community-based perspective on health issues. She also served as the Interim Chief Public Health Officer for the Cambridge Public Health Department and is an expert in community-based participatory research, which is something we were very much looking for. An associate at the Harvard School of Public Health and at Harvard Medical School. Dr. Hacker serves on the American Hospital Association Regional Policy Committee, the Massachusetts Public Health Association, and Children's Behavioral Health Initiative Advisory Council. She earned her MD from Northwestern University School of Medicine and also holds an MPH from the Boston University School of Public Health. And I'm going to introduce some of the board members and the search committee here in a little bit. But let me just tell you, we are delighted. I am delighted that Dr. Hacker is going to be leading our Board of Health, leading our health department in the future. She's so impressed, not just my administration and the board, the search committee. We introduced Dr. Hacker and had a lot of community input, knowing how important this decision is. And her energy, her enthusiasm, her knowledge across the board for community health. And the health department takes in an awful lot of areas of really it all comes around to community health, but air quality, water quality, infant mortality, obesity, gun violence, all these different issues that every community, and certainly our community, is wrestling with. We think Dr. Hacker is going to do an absolutely fantastic job at leading the health department into a new generation. And I want to introduce some of the people that are up here with me, but I would be remiss if I did not thank, first and foremost, Dr. Edie Shapiro. Edie Shapiro led, co-chaired, along with Grant Oliphant from the Pittsburgh Foundation, the search committee, and did, she could probably tell you how many resumes and how many applications, et cetera, that they sifted through and put in an awful lot of work on behalf of this community to do that. Also like to thank Dr. Ron Voorhees. Dr. Voorhees couldn't be here today, but the work that Dr. Voorhees has done in filling in when we made the replacement over a year ago. For a while, Dr. Voorhees was a candidate. He withdrew himself as a candidate, but wants to remain on and will after the transition. Definitely wanted to do that. And I also want to thank our the Heinz Endowments and the philanthropic community who really stepped up also to support what we have. Karen Gladfeld is here today representing the Heinz Endowments, but Karen and Bobby Vaught have been very, very instrumental in doing some of the things that we've done. I'd like to introduce or just acknowledge some of the search committee. I mentioned Dr. Shapiro, also Dr. Joylette Portlock is here today. She was on that search committee. Peg McCormick-Barron, who you're going to hear from in a little bit, was also on the search committee, and Mark Cherna, the Director of Human Service, the Human Service Director for Allegheny County, was also on that search committee. From the Board of Health today, with us today, we have Dr. William Youngblood, Tony Ferraro, and Ellen Stewart are here with us today. I want to also thank Dr. Lee Harrison. Dr. Harrison couldn't be here today, was out of town on some other business he had to attend to, but Chairman Harrison has done a great job and been very helpful along with this. Dr. Grant Oliphant, having a little bit of, had knee surgery, was unable to make it here today, was also very instrumental. And also like to thank from the board Dr. Dawn Burke, Joan Cleary, Dr. Lauren Roth, and Bobby Vaught, and also Cody Condovini couldn't be here today. Again, we're very, very excited about the opportunity that we have here today. And with that, I would like to turn it over to the chair of the search committee and thank her for her work on this with Dr. Isha. Thank you.
Not as tall as you here, Rich. Thank you. First, I'd like to thank Rich for his bold leadership in public health. Rich cares deeply about the health in our county, and he directed our search committee and our board to reach high in our recruitment efforts. He and his senior staff have fully supported us every step of the way in this process. Next, I want to again thank Bobby Vaught and Karen Glockfelty of the Heinz Endowments for echoing Rich's call for us to reach high in this recruitment, and for providing financial support for us to engage Waldron, the national search firm, to assist us. Waldron did an excellent job. They advertised the position widely, and they brought to us a pool of extremely qualified candidates. Of those, the committee interviewed 5 semifinalists and unanimously selected Dr. Hacker as our top choice. She has superb academic credentials, a lifelong passion for public health issues, and over 20 years of on-the-ground experience as a public health leader. In addition, she has wonderful interpersonal skills and cares deeply about developing relationships with our many community partners. Next, my thank you goes to my co-chair, Grant Oliphant, who, as Rich mentioned, has had surgery. He really wanted to be here today, but just wasn't up to it. And a big thank you to our search committee for their hard work and their insights in this process. As Rich mentioned, the committee was composed of 4 Board of Health members and 4 other community leaders. We chose leaders of key constituencies to help us in the selection process. We wanted to benefit from their points of view, and we wanted to set the stage for new important partnerships for the Board of Health. I also want to thank the full Board of Health for trusting us in this work and for fully and enthusiastically supporting our recommendation of Dr. Hacker to lead the department. Special thanks again goes to Ron Voorhees, who capably and generously led the department through this interim period of transition, and to whom we're very grateful. The next step will be for the Board of Health to take a formal vote to approve the recommendation of the search committee. This will most likely occur in the coming weeks. The board has already had an opportunity to meet Dr. Hacker and to interview her, and they have informally and unanimously offered their full support. There will be a final formal action, which is to submit this selection to the State Department of Health for their final approval. With that, I'm going to turn the podium over to Peg McCormick-Barron, who until very recently was the Executive Vice President at the West Penn Allegheny system, and who served on our search committee.
Thank you. First, I want to thank Rich for giving me the opportunity to serve on the search committee. It was a really very rewarding and fulfilling experience to welcome Dr. Hacker to Pittsburgh. And thank both Edie and Grant for their leadership in guiding us through a very extensive process. My observation is not as a physician or a public health professional, but one who's been involved in the community. And I found Dr. Hacker to be significantly head and shoulders above the candidates in terms of being someone who would be very comfortable in our communities. I think I said to Rich after that, I can see her walking the streets in our communities and interacting with people, and I think that's a very, very important component of this job. In addition to all of her academic credentials and her breadth of experience, I find her to be of the people and of the community, has a wealth of experience, and I think that will bode well for the Department of Health and the county in the future. So thank you.
With that, I want to introduce Dr. Hacker and let her say a few words. I was going to read her entire resume, but if I had done that, we would have missed the Penguins-Bruins game tomorrow night. Now, Dr. Hacker may have wanted to do that, because you may have noticed as I read that there was a little bit of Boston and Cambridge, and I'm glad she didn't wear her Bruins jersey with us today, but we are delighted that Dr. Hacker has decided to come and lead our health department. I can't say enough for the search committee, as already indicated. We're so excited that she's going to be leading this department and really taking it to a new level that this community deserves and this community is thirsting for. So without further ado, our new Health Department Director, Dr. Karen Hacker.
First of all, I just want to thank everyone. I want to thank the search committee. I definitely want to thank Rich and all of the staff that works with him. People have made me feel so incredibly welcome here. I don't know if anyone knows Massachusetts, but it's not necessarily the warmest place in the world. Pittsburgh is far warmer than my hometown right now. I also think that Pittsburgh is a really exciting place, and I am really proud to become a new member of the community, the city, the county, the region, where there's such a distinguished past and such promise for the future. For me, I've worked in public and community health for my entire career, and most of that time spent in the public sector. I've been a primary care physician working with teenagers. In fact, I saw patients yesterday. And I've had a passion for improving the health of communities. You've heard a little bit about my career path up to this point. I think that in particular, Allegheny County represents a really unique opportunity to make a difference. With the support of an energized county exec, Rich Fitzgerald, who's committed and enthusiastic to improving the public's health, and all of the key stakeholders who are so incredibly aligned and interested in collaborating to improve both the department and the county's health, there couldn't be a better scenario. Also, for those who are aware of the Affordable Care Act and all the changes that are going on right now in healthcare reform in this country, there's an invigorating effort to try to link public health and the delivery system in a way that hasn't happened. And I think those opportunities also exist here in a way that they may not in other parts of our country. But there's lots of challenges. While the county has already done a lot, there is much to do, and you know many of the problems. There are environmental issues in air and water. There's disparities in healthcare access, infant mortality issues, asthma, obesity, cardiovascular issues, and violence that's all demanding our attention. We've got to revitalize the health department, and we have to lead it into the future to really be one of the best departments, if not the best in the nation, in terms of public health. I have many goals. Probably the first is getting to know the department and the people in it and understanding their strengths, learning much more about the community, the constituents, understanding what the issues are, and setting a realistic agenda given the challenges before us. I hope to focus on some key areas, first and foremost, but ultimately, I hope to contribute to a healthier Allegheny County. Thank you.
And with that, we'll open up to any questions you might